Morning, everybody. I'm so happy to see everyone this morning, and thank you so much for joining us this morning. And this morning we're talking about skin prick tests, which is very exciting because I've never done one. And to tell us all about it this morning is Dr. Lim from IMC. Hi, Dr. Lim. How are you?
Hello, good morning, Susan. I'm good. Thank you very much. And very good morning to everyone listening in. I'm Dr. Lim, and I'm GP practicing at the International Medical Clinic with a special interest in skin. And hence, that's why I'm here today to talk about a very exciting thing that IMC is going to introduce, which is the skin prick test. Right. Shall I begin the presentation? All right, okay, good. Okay, thank you. All right, so so what exactly is the skin prick test? I'm sure some of you might have heard it before in the past. So it's a procedure where a small amount of substances are introduced into the upper layers of the skin to test for an allergy. So essentially it is an allergy test. And results are observable about 15 minutes later, meaning that the results are available on the same day. Right, versus a blood test which may take a few weeks, right? And this test is generally a very safe and well tolerated procedure. All right. Now we're going to go about talking about why we need a skin prick test, right? So basically, skin prick tests are often done for certain situations where an allergy is suspected. For example, in hay fever, allergic rhinitis, where a lot of times the condition is triggered or made worse by pollens in the air, for example, or molds. And asthma as well. Asthma, certain people with asthma are allergic to certain pollens as well as environmental allergens. And atopic dermatitis or eczema. Now I need to say this with a little bit of caveat. Well, atopic dermatitis or eczema as we know it, in general, it is not a allergy symptom, but in young kids, sometimes it can be associated with a food or an environmental allergy. Right, and of course, if there are conditions of where the doctor suspect that it might be due to the symptoms might be due to food allergy or an environmental allergy, then skin prick test can be done to determine what is the allergen that is causing the symptoms. Right. So we know that with allergy symptoms, it can be quite debilitating to patients, especially if symptoms are prolonged and didn't get quite a period where there's no symptoms. So take for example the case of allergic rhinitis or hay fever. Prolonged or recurrent symptoms for a long period of time can actually lead to easy sinus infection, for example, can allow one to be prone to sinus infection. And having to battle the recurrent symptoms also can lead to fatigue, and people with allergic rhinitis or hay fever usually needs to be on long-term medication to control the allergy symptoms, and most often is a form of antihistamine, and taking antihistamine long-term, although in most cases generally it is not it doesn't have a lot of very major side effects, but I mean it can have side effects like dry mouth or dry eyes. Right. Now, how about food allergies? Food allergies, if left undiagnosed and untreated, can be life-threatening. And we're talking about those anaphylactic shock, and there are people who are very sensitive to certain type of food, and a tiny amount in the food or in a food that is unsuspecting to them can actually cause a very severe allergy and may end up in hospital needing treatment, right? And that sometimes can be quite hard to avoid because, for example, for nuts, you may not know that the certain food or dish that you take contains nuts, for example, right? And of course, I mean the consequence is that you may need to avoid food for life, the one that is causing the allergy. Right now, so now that I've discussed all the the indications for doing the test, so are there conditions which skin prick test can be done? So skin prick test is not the answer to certain type of symptoms as shown on the slide here. So if someone comes in with a rash but without an allergy symptoms, then skin prick test may not be the appropriate test to do in subsequent tests, because the rash can be due to most can be due to other things. And what we're looking for are allergic symptoms, which occurs in the form of things like hives, itchiness, swelling of the throat, the tongue, the face, and things like that. All right. So for another good example is food intolerance. So food intolerance often comes in the form of lactose intolerance, or other forms of intolerance, or even celiac disease is a form of food intolerance as well. So this can't be tested with the skin prick test, and for people who has known allergy and is already on immunotherapy treatment for that, skin prick test is often not a very good way to assess the effectiveness. So a blood test instead is a more appropriate test for that sort of circumstances. And if someone says that I think I might be allergic to smoke, fumes, or perfumes, this can be tested as well. Yeah, I think the reasons are twofold. One, there's no appropriate reagents that is available commercially to test this sort of things on the skin prick test. And secondly, respiratory irritants by its very nature can affect everyone, not only people who are allergic to it. And of course, there are people that may want to do an allergy test because they've got a family history of allergy, and just want to test whether a child is allergic to anything. So in general, we would want to discourage that, because a broad-based test without a history of or at least a suspected history of allergy may turn out to be counterproductive because of things like false positive or false negative tests. Right? Okay, so as I mentioned previously, I've got a special interest in skin. So I see a lot of patients with skin, and sometimes they're asking whether the skin symptoms is due to allergy or not. So a way to differentiate between the two is with the type of rash that appears. So things like hives and itch, they are often associated with an allergy reaction. Yeah, so if a person has got symptoms like that, then it is probably worth doing an allergy test to see if allergy might be responsible for that sort of symptoms. But in a case of eczema, as I mentioned earlier, eczema tends not to be associated with allergy, because it's not a allergic symptoms per se. Except for babies and young children, where a certain proportion of them can be due to food allergies and it can be associated. But other than that, most adults, eczema is not definitely not an allergy symptoms, although allergy can play a part in it by causing the symptoms to become worse. Yeah, so yeah. And so when will doctors recommend a skin prick test? Usually when there's suspicion of allergy, as mentioned earlier, and if the symptoms are severe or persistent. Yeah, and things have been tried, various type of treatment methods has been tried and isn't effective, then definitely allergy test can be considered. Yeah, but it's best to discuss with the doctor what type of allergy test to do. All right. Okay. And so who can't have a test? Allergy tests, there are basically two types. You can do it either by the skin prick test, or you can do it by a blood test. And skin prick test is not for everyone. So is the blood test as well. So who can't have a skin prick test will be people that doesn't have a clear area of skin to do the the testing on. So usually we do the testing on the back of the I'll say the forearm area, or the back itself, and so we need clear areas to do the test on, meaning clear skin without any rashes or any other blemishes that may affect the interpretation of the results. And also people with severe dermographism. Dermographism is basically a condition where it is similar to hives, except that it is induced by pressure. Yeah, so it is meaning that if there is any pressure that happens on the skin, it can induce a hive-like reaction, and that might interfere with the testing results as well. Or patients that are unable to cooperate with the test, meaning that they tend to squiggle, they don't like the scratchy feeling when the test is being done, and that can certainly affect the conduct of the test, because we need patients to be able to put the arms on, keep it still throughout the duration of the test. And for patients who are unable to stop antihistamine or other medication, some of these medications can affect the accuracy of the test. And also certain circumstances where it might be dangerous, or the risk might be slightly high, risk of adverse reaction might be high when considering the skin prick test. Those conditions will be if there's a life-threatening allergic reaction before in the past, for example, anaphylaxis that require treatment in the hospital, emergency department, or worse, higher levels, poorly controlled asthma, pregnant mothers, babies, and infants less than 2 years old. So for these patients, we may recommend that they do the test in a specialist clinic to minimize the risk of adverse reaction, and just because the specialist clinic probably will be able to deal with more serious adverse effects that arise from the testing. Yeah. Okay, now that I mentioned adverse effects, what are the potential adverse effects from the skin prick test? All right, so skin prick test is generally a very safe procedure, but however, it is not 100% safe. There is still a risk, although it's very low, a low risk of serious side effects. That happens when the allergens actually get into the bloodstream. Right, so skin prick test is basically only pricking the upper layer of the skin. You don't see blood, and that's why the risk is low, but not zero. And when that happens, allergic reaction or even an anaphylactic reaction can develop. The percentage of such serious reactions are really low. It's less than 0.1%. And in large-scale studies that's been done, only 0.033% of patients has got serious allergies. And patients, depending on their background and their risk factors, some of them may need to be monitored after the test. And if everything's fine, they can go back home. All right. So next, I want to talk about what's the difference between a skin prick test as well as a blood test. All right. So for skin prick test, as I mentioned earlier, you get the results quite fast in about 15 minutes. It is generally a less invasive one because it's only picking the upper layer of the skin, and you don't see blood after the procedure at all. Yeah, versus a blood test, of course. I mean, where you have to go deeper and into the veins. So how it appears is usually appear as a minor scratch on the skin, and depending on the amount of allergens that we want to test. So this may be done individually, or sometimes it can be done at one go with a special device. Right, and results are often visible on the skin, and what the results that we are looking at will be for a positive result will be a wheal and a flare. So wheal is basically something like a mosquito bite. So we can see the appearance of a mosquito bite on the skin if it's positive, and because it is demonstrated on the skin, you know that you can actually see the results for yourself instead of the blood test, which you only read the report. Yeah, and there's better sensitivity for clinically valid allergies as compared to the blood test. And it's not affected by high levels of IgE, which sometimes can lead to false positive results in the blood test. Now, whereas for blood tests, it can be used, it's more available widely. You can walk into any GP offices in Singapore. You say you want to do a blood test for allergy, and most clinics will be able to do that for you. But whereas for skin prick test, it's only available at certain centers. Yeah, and of course for blood tests, you don't need the patient to be cooperative to the test requirements, but obviously you need to draw blood from there, and they may not be very good, or some children may be quite wary of blood tests and may not like blood tests. So yeah, and however, for blood tests, there's no risk at all of any systemic reaction, simply because you're not introducing the allergens at all onto the body. You're just drawing up blood and testing for the responsible antibodies to the allergen, and because of that, people with high risk of who had previous severe allergy reaction might be recommended to do a blood test instead of a skin prick test, for example. Right? Of course, I mean, blood test doesn't need you to have clear skin to do the test on. It is not affected by medication. You can continue the medication while you are testing for the allergy. And in general, more allergens might be available depending on the laboratory that you send the test to. And of course, the other advantage is that you don't need to stay for measurement after the test. Like, for example, the skin prick test will require you to remain in the office for about 15 minutes where the test is read. Whereas for blood test, you don't have to stay in the office after the test. You can go home straight after the blood test. But of course, the results will come back much later, about 1 or 2 weeks. Yeah. Now, so how do we prepare for the skin prick test? So before coming for a skin prick test, there are a few things that the patient needs to be aware of. Okay, so mainly with regards to the medication. So as mentioned before, certain medications can actually affect the results of the skin prick test. So antihistamine is a foremost agent that can be responsible. So the mosquito bite wheal type of wheal that appears as a positive skin prick test appears as a result of release of histamine from certain cells in the skin. So if you take antihistamine, that can blunt the effect of a positive test, and hence it can affect the accuracy of the test. So antihistamines need to be stopped for at least 4 days before the test is conducted. Also caution need to be exercised in cold and flu medication, because some of these medications do contain antihistamine. Antidepressants, some antidepressants do have antihistamine-like activity, which may interfere with the test. And in general, when in doubt, discuss with your doctor what are the medications that may affect the test, and the doctor may then recommend that you withhold the medication if the doctor judge that withholding medication is not going to seriously harm the condition that you are using it for treatment. And if it's safe to do so, I think the doctor may recommend that you stop the medication prior to coming for the test. Right. So what are the things that we can actually test for in a skin prick test? So the next slide will show this. All right, so we can test for the following allergens. Right, so in general, skin prick test and as well as for the blood test is the items are split into either environmental allergens or food. So for environmental allergens would be in the form of dust mites. This is very popular because a lot of people are allergic to dust mites. People who has got hay fever, people who has got eczema, yeah, and most most tiny fungi that tend to live on moist and damp area like the bathroom, kitchen, air conditioning units, for example. Animals, cats and dog fur. I would say fur is more like a dander. So it's what they shed off that sometimes can cause an allergy. And for food wise, we have all the items listed there. So very popular will be things like milk, egg, wheat, nuts, shellfish. So these are the more popular items to test for, and others as well. Right. So in the next couple of slides, I'm going to describe how we actually do the skin prick test. I would love to do a demonstration, but we don't have a demo kit yet at this moment in time, so can't do that for you. So you just have to bear with me and just go through the procedure while I describe them. All right. Okay. So what happens in the skin prick test? So it is a in general, what the doctor will do will be ask the patient to put up his or her arm on the table, and then we'll clean up that arm with alcohol swipe, just make sure it's clean, and then after cleaning, we'll mark certain areas on the foreskin. On the forearm, the skin on the forearm. So we mark on certain areas, and then we'll put on a drop of allergen next to each marking. Right. So after that is done, a disposable lancet, which is a small sharp object, will be used to prick the extracts onto the skin surface. Right. There won't be any bleeding because it's only on the top layer of the skin. The feeling is a small scratch that some, like for example, if you have a brush against the sharp tip of the leaf, for example, that sort of feeling. All right. Okay. Now, so this slide will show more detail what I mentioned earlier. So as you can see on the skin on the forearm, will be some markings there, and then on the markings, next to the markings will be the allergen drops will be put on, and then this sterile lancet will be used to do a tiny prick on the top of the skin. And in the case of a positive test, this wheel that is shown like a raised bump or more like a mosquito bite will appear on certain areas that are positive. Right. Now, so this is a device that is that can be used to do the skin prick testing, and this particular device can be used to do quite a number of different allergens at one time. All right. In general, we do prefer to do it individually, but in the case where the doctor may think that if let's say for example, if a kid is going to be quite hard to stay still for the test and to do the individual pricking, we might consider using a jig like this to just do a one-time testing on the skin with for multiple allergens, of course. Yeah. Okay. So what happens after the test? After the test, the patients will be instructed to wash away. So this is after the results have been read. So after the skin prick test has been done previously, patients need to wait for about 15 minutes to 20 minutes, and then come back to the clinic again for the doctor or the nurse to have a look and measure the readings. So we'll need to measure what the size of the wheal that is formed, and for each of the areas that's tested. Right. So once that is done, then you can wash away the markings, wash your the skin. The most common effects after doing the test is a mild skin itch, which usually resolve within a few hours, or within 24 hours the most. Okay, that you can actually use to treat. If it gets too itchy, you can use anti-itch cream or antihistamine if needed to treat the itch. And there is potentially a what we call a late phase reaction that sometimes it's not common, but it can sometimes arise from a skin prick test. This is a delayed, what we call delayed immune-mediated response. So it often comes in the form of a local skin swelling or wheezing in people with asthma. So no treatment is generally required because this sort of late phase reaction will go away on its own, usually after about 36 hours. And wheezing in asthmatics, obviously the patient will need to use his or her asthma medication to manage. Yeah. And for people with, for patients who are deemed to be at high risk of, developing a reaction after the skin prick test, we would ask them to stay on for another 20 minutes after the test to observe for any potential adverse reactions. So these high risk patients will be people with a history of severe allergies, severe or poorly controlled asthma. They use certain medication, or if there are multiple positive results that was seen, yeah, on the skin. All right. So the next slide will show what happens when we during the test, and how we actually interpret and measure the test. So so this small bump here will appear, and we will measure the diameter of the bump itself, and depending on the time on the measurements, we can then decide if the result is positive or negative. In addition to the allergens that is normally used on the skin, a positive and a negative control is also being used as a comparison prick. So the positive control is usually histamine itself, and the negative control is usually salt water, or the buffer that the other allergens was being used for. Right. So with comparison between the positive and negative control, as well as measuring the size of the bump, we can actually determine if the test is a positive or negative. Right. So in terms of so what happens after the results are available? Does a positive test always mean something, or negative test mean anything at all? So in general, a positive skin prick test does not predict the nature of the allergy symptoms, although it does give an indication that a person is likely to be allergic to that substance, right? If it meets the size criteria, if the bump meets size criteria, but it does not predict the nature of the allergy symptoms, like what sort of symptoms that you will get. You can't tell just from the test. And a negative skin prick test in children does not rule out the possibility of a future development of allergy. Yeah, I mean, this makes common sense. And the skin prick test may be positive when a patient has a previous allergy of a previous allergy that has since resolved. So, for example, for children who has actually outgrown certain food allergies, doing the skin prick test may show up positive, but then they are already, not sensitized to that food allergy, for example, right? So, so in the last few slides, I'm going to talk about how to manage allergies in general. How to manage the if you know that you're allergic to certain things, right? So one of the therapy that we can consider is known as immunotherapy. How this works is by introducing small amounts of allergen into the body over a long period of time to induce what we call immune tolerance. So to allow the immune system to be tolerant of that substance, so that next time when you're exposed to that food or the environmental agents, you will not develop an allergic reaction. So, however, this sort of treatment typically quite costly, and usually long periods of treatment are required in order to induce a sustained sort of symptom-free period. Yeah, and immunotherapy has been used for allergies to certain allergens like environmental allergens like tree pollens, grass pollens, weed pollens, cats and dogs, dust mites, moles, and cockroaches. So efficacy has actually been demonstrated for patients who are allergic to these environmental agents. Yeah, I'll come to food in a while. Yeah, all right. So how do you deal with dust mite allergy? Dust mite allergy is an allergic reaction to tiny bugs that commonly live in the house dust. So I mean, it can live in areas where there's dust. It can also live in areas where there aren't any dust. So it makes it one of the most difficult allergies to control. And usually how you do it currently, the current recommendations to deal with dust mite allergens will be the following list. So you can consider using a allergen-proof bed cover and keep mattress and pillows in dust-proof or allergen-blocking covers. But first and foremost, obviously, you need to vacuum your living quarters, your beddings, your furniture regularly. Usually once a week is recommended. And besides using the bed covers, you also recommend that you wash the beddings weekly in hot water or use a dryer at a high temperature. So usually you will want to the temperature to be somewhere around 55 to 65 degrees, yeah, in order to destroy the mites. And stuffed toys. This is often a very concealed environment where the dust mite can live, and need to be washed regularly as well. All right, and rugs are also another potential source of dust mites. So you might want to consider removing them from the bedroom if you're allergic to dust mite. Now, mold allergy in Singapore. As I mentioned earlier, mold are small fungus that likes to live in moist and damp area. So make sure that you clean up your bathroom, your kitchen regularly, and sometimes they can hide in aircons as well. So make sure you get your aircon clean, maintained as per the manufacturer's recommendation. Yeah, and yeah. Good. And I think yeah, so as I alluded to earlier, IMC will be doing the skin prick test pretty soon, and we are quite excited to start this service in IMC, and hopefully by having this new service, we can better service our patients and lead to better management of their allergy symptoms. All right. Okay. So I think that will be the end of my presentation, and I'm happy to take any questions you have. Yeah.
Okay. I think I have a few questions. So,
Sure.
Dr. Lim, if you stop sharing, then we can see you in a full screen.
All right. Okay. Good.
There we go. Thank you. So I've always suspected that my daughter Joey, who is 8 years old, I've always suspected she has allergies towards cow's milk. But actually, I'm such a bad mother. I haven't taken her to the doctor to actually confirm that she's allergic to it. Oops.
Right.
But so her symptoms, as you were explaining, like runny nose and things like that. But it can be actually anything and everything. So my question is, can anyone just rock up and see you with these kind of theories? Like, can I come to IMC and say, hey, Dr. Lim, can you just do the skin test, prick test on my daughter Joey?
Okay. Yeah, I mean, definitely, please this we were happy to see patients, definitely, for sure. All right, because we want to also find out whether the allergies that whether the symptoms that you're having is actually due to allergy, and whether allergy test would be appropriate for them. So definitely, by all means, please bring her to see us. Yeah.
And how do I prepare her for going, because she's quite scared of needles and doctors, to be honest. So as an 8-year-old, how do you prepare an 8-year-old to go and see you, for example?
Oh, okay. Well, I think she can come as no preparation is really needed for the first consultation, really. Yeah, we just want to see how she's doing, you know, how bubbly she is, and really it's just a conversation to find out more about what has been bothering her, and of course your concerns as well, and definitely the first consult is really just a discussion. You don't have to go straight into any test at all, and the best is to the best way to do it is to discuss, and then try to come up with hypothesis whether an allergy related cause is possible in this situation. If it's possible, then definitely we can discuss the options, and potentially arrange for a test on another day. So it doesn't have to be on the first consultation. The first consultation is very important for us to find out if the symptoms are due to allergy or not. Yeah.
Right. And another question of mine is that, you've listed all of the allergies that you test for. So is that like the actual list that you're testing for? Or let's say in my daughter's case, Joey, who I think has a cow smoke allergy, would you just test for that specific thing? Or does the skin prick test you for everything, like dog hair, all those things that you've listed on that slide?
Right. It's a very good question. Thank you for that, Susan. So yeah, so if the with food allergy, for example, it's sometimes very hard to determine what can be the culprit food that is potentially responsible for allergy symptoms, because people don't usually just eat a single food. They'll take in lots of different type of food. So sometimes keeping a food diary may be a very good way of trying to eliminate and trying to narrow down to the possible food that might be responsible for a potential allergic reaction, for example. So once that has been narrowed down, then we will proceed on to do the test according to the items that we suspect might be causing the allergy symptoms. So it won't be a blanket do all allergy tests for everyone that comes in for allergy testing, and hence it's very important to discuss with the doctor what you think might be most likely allergens that is causing the symptoms, for example. Yeah.
Okay. And in your experience, do kids or people outgrow their allergies, or do they have it forever?
Yeah, it's a very good question as well. It's one of the more commonly asked questions. Children do outgrow their allergies, and it really depends on the type of food as well. So with very young children or very young infants, the cow's milk allergies tend to be more common. Cow's milk and even eggs. And as a child grows older, they may develop nuts or seafood allergies or some other allergies. So about 1/3 of children do grow out of their food allergy, and within about maybe 1 to 3 years of diagnosis, they can actually grow out of that. The allergies that tends to grow out easier will be things like cow's milk, hen's egg, and milk. So and wheat as well. Now, nuts and seafood and fish, they tend to be a little bit harder to grow out of. Yeah, so more people tends to have symptoms that persist on for life, compared to things like cow's milk or the eggs. Yeah.
Right. And I find it fascinating when people say, "Oh, I'm allergic to cashew nuts, but not peanuts." but they're like in the same family, right? It's nuts. But does the skin prick test tell you, all right, Susan, you're allergic to cashew nuts, but not peanuts? Does it tell you what exactly the kind of nut?
Well, the skin prick test, I think it really depends on the allergens available for testing. So in terms of skin prick test, there are several species of nuts that can be tested too. All right.
Okay.
The alternative would be to do a blood test where they have probably a wider selection of the possible nuts that can be tested, like Brazil nuts, and almond, and then, other nuts. Yeah. So basically, there are options for testing all these nuts, whether with the skin prick test or with the blood test. Yeah.
Okay.
And it's possible for
this.
Yeah. So it's
Yeah.
possible for a person to be allergic to one nut, but not another nut. Although sometimes there can be cross reaction. Yeah. That people can be allergic to more than one nut. That's still possible as well. Yeah.
Yeah, I find it fascinating that, one person can be allergic to a specific nut, but not the other.
Yeah.
And it makes it very, very hard to have dinner parties when, like, everybody's like allergic to everything. It's very hard, but it's definitely very good to know. I had a dinner party once and I almost killed a person because she didn't tell me she was allergic to wheat. Oh my gosh. So she was so, so, so sick. So yeah, it's crazy. Another question of mine is like, when are you starting to take in skin prick tests can people book appointments now?
Well, I don't know for sure when it's coming soon for sure.
Okay.
I think yeah, I may not be able to answer this question exactly, but we're hoping by the end of the year, we're hoping. Yeah. So yeah, so in due time, please watch this space. We'll definitely make announcement when it's available. Yeah.
Okay.
All right.
Perfect. Then I know when to come and see you.
Yeah,
Good.
sure.
From your experience doing all these like allergy tests and all of that, from your experience, do you find a lot of children developing allergies when they move to Singapore? Like, for example, when they lived in Europe before and then coming here, they have all these like allergies that they have accumulated because they live in Singapore?
Yeah, that is certainly possible, especially for younger children. That is certainly possible because the exposure, the mix of things that are exposed to back in home country and in Singapore are different. So definitely that is still possible. And when children are young, their immune system are still developing. So constant changes of environment can disrupt that process and cause new allergies to surface. That is certainly possible. In practice, I would say yes. I mean, there's some cases, but I wouldn't say it is across the board. And I wouldn't think they are even the majority of people that develop new allergies when they relocate here. So certainly it is something at the back of our mind, but I wouldn't say it's that common.
Okay. And this might be a very maybe not a very good question, but do you know when you're talking about when you prick it and you say that there's a mosquito, it looks like a mosquito bite, right?
Yeah.
And it's red.
Yeah.
And so does it mean the more redder and the more bigger the bite, the more you're allergic to something, or it doesn't really matter?
Right. But very good question, must say, really. And so the size of the reaction tells us the likelihood of allergy to that substance, but it doesn't tell us how severe the reaction will be when you're exposed to it. So it's got no relation to the size, the severity of the symptoms got no relation to the size of the mosquito bites, but the likelihood of allergy, there is a relation. It's related to that. Yeah.
Right. Okay. And obviously you get the results after 15, 20 minutes.
That's
and
right.
Then obviously you then prescribe, what's the next stage to say, right, Susan, you are allergic to cashew nuts. So you just avoid that. And what if I want to like try to train myself to be not allergic to it?
Okay, very good question again. So following the test, we will consult with the patient again to let them know the result and also what the implications of the positive test. So with food allergy, for example, sometimes I mean elimination diet is still the best way to prevent recurrences, although that may not be possible in all cases. And the next treatment that can be done is a desensitization treatment. So another option is that you can actually do immunotherapy to certain food allergens, and through that, hopefully, that can improve your tolerance of that food and reduce the severity or the frequency of reactions whenever you consume that food. So this is another potential option apart from staying away from that food. And so sometimes we may want to refer patients to allergists for further discussion on this, and how they can and whether immunotherapy can help them. So immunotherapy is not for all allergens, but it is useful for certain allergens, and that usually has to be discussed with the allergist. Yeah.
Okay, an allergy specialist.
Yeah, that's right. Yeah.
Okay. All right. Well, I've found this topic very, very interesting. Thank you so much. And I think I might actually come and see you when you are all ready with your skin prick test for my daughter Joey to come and see you and see what actually is causing her sniffles every single time she eats something. So thank you so much. If there's any other questions, please pop it in the chat. Otherwise, I'm quite conscious of time that Dr. Lim has some patients to see today. Dr. Lim, if people want to contact you directly and ask more questions about the skin prick test, can they email you directly, or can they email IMC and book a time and see you?
Yes, absolutely. I mean, I welcome all questions. Please email to IMC, and the email will get to me eventually. So that's not a concern. Please feel free, including yourself, if you've got any questions, I'll be happy to address them. Yeah, please let me know. Yeah, just email to IMC. Yeah, we'll take care of that. Yeah.
Definitely. What I'm going to do is I'm going to share your details and contact numbers and email addresses to everybody who signed up today, and also the recording for everyone who want to watch it again and also see the slides that Dr. Lim has prepared for us today. Dr. Lim, thank you so much for taking your time this morning to explain how this whole process goes, and I'm looking forward to seeing you at the end of the year then.
My pleasure. Thank you very much, Susan. Thanks. And
thank you. Have a great day.
Thank you.
Have a great day and enjoy the rest of the Friday. Thank you. Thanks everyone for tuning in. Thanks.
Bye.
Bye.
Bye.